It's amazing where we are with cell therapies and gene therapies. And if 10-year-old me were to be able to see what's available in 2025, I really would have thought it was science fiction. So we've come a long way, and it's very exciting. So we'll talk about the panel discussion right now with Dr. Zhang and Dr. Kalkar about lymphoma and cell therapies, respectively. I will end it on time at 12:55 so that we can go straight to the Q&A session. So I think I only have time for maybe one or two questions. Dr. Kelkar, one of my questions for you is about costs and accessibility of cell therapies and gene therapies. Could you comment on that? And then maybe broadly to both of you, where can patients get these products? Do you think that they're available in the community and or will ever be available in the community? What do you think about that?
It's a great question. And as you had mentioned earlier, one of my areas of interest is kind of addressing the high costs related to these treatments. Um, Basically, every single one of these cell therapies starts at a list price of somewhere around $400,000, and that doesn't even include the cost of the hospitalization and transplant that goes with it. So they're exceedingly expensive, and we don't right now, at least, there isn't a consistent model to figure out how to pay for all these in a way that makes these treatments accessible to every patient. And so that's one of those areas where we're looking at different things, whether it's kind of value-based reimbursements uh, or some other ways of making sure that uh, patients and health systems are not paying for treatments that are not effective, and focusing those kind of payments back to companies and for treatments that are working the best and adding the most length of life and quality of life for patients. So it is to say it's an evolving area. It's a big concern for I think all of us, but it is also in some sense a good problem to have in that we have these exciting treatments to begin with that we can have these conversations.
Yeah, and I completely agree with that. So is it isolated to academics? Maybe Dr. Zhang, do you feel that in any way?
I do think like with diffuse large B-cell lymphoma or aggressive lymphoma, that's the only chance for a cure in the relapse refractory setting. So even though, we talk about cost, we talk about access, we also have to talk about patients, right? They have to have a caregiver, they have to be able to travel to a place that they're not familiar with, and that sometimes deter them from getting the therapy. One thing I do think that we can probably do a little bit better to in the future is to select people that are highly likely to respond. If we can do that, then that might make the treatment more feasible. Um, I don't know if community centers. I think big community center definitely can do CAR T, but like smaller standalone cancer center or cancer clinic probably will have a big time, a difficult time. So yeah.
Got it.
Yeah,
Probably a support that is required around the products, right?
yeah, it's extremely resource intensive. And that as I mentioned a little bit about side effects, like there's just a lot of monitoring involved and close follow-up. And so I think you really do need experience and expertise and places like Moffitt, where you guys do a lot of these, obviously. I think that's a big center, but it is harder to deliver these at freestanding cancer centers.